Namaste. Greetings from all of us at Apollo Hospitals and welcome to our Facebook Live session. This is Dr. Srinidhi Chidambaram and I hope you're all staying safe and keeping great health. We have been presenting Facebook Live sessions for a while now on key topics that each one of you should be aware of because knowledge is key to early recognition of disease. And you know that early diagnosis can lead to early treatment and better chances. And when the information comes from the top experts in the various specialties, it's a great way to get factual and authentic details, especially in this era of social media myths and misinformation. Our habits and lifestyle makes us what we are. While a lifetime of healthy habits like a balanced diet or exercise, good sleep would enhance your health, the reverse is also true. If you indulge in unhealthy behavior, unhealthy practices, you will be abusing your body and that will lead to complications in your health. Lung cancer is a very common form of cancer all over the world, a leading cause of cancer deaths, both among men and women. Today is World Lung Cancer Day, a day that is dedicated to lung cancer awareness, also promotion of overall lung health. Every year, World Lung Cancer Day helps inform all of us about the risk factors that lead to lung cancer, particularly about smoking cigarettes and other harmful tobacco products. Smoking is one of the most common risk factors associated with lung cancer. According to the CDC, the tobacco in smoke contains at least 70 carcinogens that can lead to different types of cancer. And it is hugely damaging to the cells that line the lungs. So it's very, very important to understand the harmful effects of smoking and role of smoking in lung cancer, which is what we're going to discuss today. And to enlighten us on this topic, I'm delighted to welcome Dr. SVSS Prasad. Dr. Prasad is a well-known medical and hemato-oncologist who has been practicing for more than 25 years. He holds extensive practice and experience in lung cancer treatment of other malignancies, head and neck, breast, stomach, colon, and so on, as well as chemotherapy and other management of hematological and pediatric malignancies. He has done extensive clinical research in cancer, completed his MBBS from the Osmania Medical College in Hyderabad. In 1982, he completed his MD in Pediatrics from PGI-MER Chandigarh, and then a DM in Medical Oncology from the Cancer Institute, Adyar, Chennai. He has been with Apollo Hospitals, Hyderabad since 1996. Welcome, Dr. Prasad, to this special session on lung cancer and the role of smoking. Thank you so much for joining us. But let's begin by talking a bit about lung cancer itself. What is it and are there different types of lung cancer?
Good morning, everyone, and thanks for the invite. Lung cancer is of two main varieties, a small cell lung cancer and a non-small cell lung cancer. The non-small cell lung cancer has some further varieties which people may commonly be hearing, squamous cell carcinoma, adenocarcinoma, large cell cancer, and so on. And of course, even in them, again, the squamous cell carcinoma and the adenocarcinoma are the frequent ones which we come about. And adenocarcinoma has thrown up a lot of possibilities of treatment in the past decade. And so much so, there is something called precision approach to cancer in lung cancer nowadays.
So what are the risk factors for lung cancer?
Yes, of course, as is the topic for today, cigarette smoking is the most common cause. The 80% of lung cancers are caused in smokers. And we have other things like asbestos exposure. Asbestos means the fine asbestos fibers that we have in the asbestos factories. That's where they're so fine that they get into the lung alveoli and the bronchial pathways, and then over a period of time they cause cancer. It's not the asbestos sheets that we have on the house surfaces or house roofs, so to say. And then of course we have radon gas, which is seen in high-rise buildings actually, which is a kind of a radioactive substance which over a period of time can cause lung cancer. And of course pollution. We don't know what exactly in the pollution, which harmful substance is causing it, but then yes, pollution is also increasing lung cancers.
So, what are the earliest symptoms of lung cancer and how does it progress? What symptoms happen over a period of time?
Right. Lung cancer, of course, as we all can guess, the commonest symptom is cough, and sometimes there can be blood in the sputum while soon after coughing or while coughing, and we can have chest pain because there is a mass of tumor in the chest pressing on some of the tissues, and then of course there can be weight loss, lack of appetite, and unexplained weight loss is what we see. So any person who is having weight loss over a period of time and it's ongoing, then we should be thinking of lung cancer. These are some of the common symptoms.
One always says that cancer, if detected early, it's always better. So, at what point do you think that medical advice should be sought when somebody has a cough? Or because some of these symptoms are common to many other conditions as well. So, when does one actually seek?
Good question, I would say. The cough is commonly seen, as you rightly said, and so a cough which doesn't subside for at least 2 weeks, let us say, and ongoing cough, and then development of these newer problems like blood in the sputum, and then weight loss, and so on. So that should trigger any cough which is more than 2 weeks should trigger us to think of lung cancer so that we can detect it early. It's always our wish that we would like to detect lung cancer very early, and that's how we should. High index of suspicion, that's the most important thing, so that the doctor and the patient both together can detect an early lung cancer.
So once the patient comes to the doctor and there's the suspicion, what would be the different aspects of examination and investigations that are done so that this can be diagnosed?
Sure. When the patient comes with this type of a history, a cough which is nagging, which is going on for 2 weeks or more, weight loss, then of course we suspect. And as oncologists, somebody who comes to our table, it's our duty to rule out a lung cancer. And so we would generally start with a chest X-ray, which can show a mass in the lung or near the airways. And then of course we do a CT scan to further confirm or even detect sometimes small tumors may not be detectable on the chest X-ray. So we do a CT scan. Then of course if they're really producing sputum, especially with blood, or even without blood, let me say, we would have to do sputum cytology where we can detect the malignant cells. If we cross these steps and yes, we do find a mass in the lung or a tumor in the lung, then we try to do a biopsy. It can be a fine needle biopsy, either through a bronchoscope, which is put through the windpipe, and or it can be directly from the outside on a CT scan guided area. So we do a biopsy, and then we, in fact, sometimes we may have to do a videostereoscopy, which is a hole near the windpipe, in the front of the windpipe, and then they go into the middle of the chest area. And if there is any lymph node or tumor which has been detected on the CT scan, that would be biopsied. So that is how we come to a diagnosis of lung cancer.
And how is it staged and treated, and what is
right? Once the diagnosis is made, in fact, lung cancer or any cancer, staging of the cancer forms an important part of the story. And so we do. Well, the CT scan, if we do for the abdomen and other parts, that also can stage. Nowadays, we have the PET CT scan, which is quite popular and seen in many places, available in many places, I mean. And so we can do a PET CT scan, which shows the extent of the disease. Staging is nothing but the extent of the disease. And sometimes an MRI also can show these things. So that's how the staging is done.
And what would be the major modalities of treatment for lung cancer? Are they the same?
Right. Right.
This
is in a way connected to your previous question of early detection. If it is detected very early in stage 1 or stage 2, you can cure them actually. Surgery, if it is the traditional way we talk to all patients is, if it is the size of a rupee coin, then you can think of removing the tumor totally or a part of the lung called lobectomy. Rarely, these days, it's less in practice, but of course, pneumonectomy, that entire lung is also removed. That is the definitive way of curing a lung cancer. When you remove it totally, that's when you can start thinking of curing it. Subsequently, if in cases which are a little more advanced, you may not be able to do this surgery, so we'll have to offer them chemotherapy, reduce the tumor to a size which is encompassable with radiotherapy, and then give radiotherapy. Nowadays, we have got what is called as targeted therapies. I was telling you about the adenocarcinoma variety, which has
Yeah.
got varieties like EGFR positive tumor, ALK positive tumor, ROS positive tumor. Those are all biomarkers which are identified in the tumor cells, and if they are positive for that, you can even give them oral treatments, just tablets at home, and they do well for a few years. So these are all the treatments that are available for lung cancer. That's what I was telling even about the precision. The precision is you identify the target and then give the targeted therapy, maybe tablets, maybe injections. Immunotherapies nowadays are also in vogue, and they are also giving good results. Lots of opportunities for treating lung cancers, but this should not give a message to the audience that you can get away with lung cancer easily. No, it is better to prevent it rather than treat it. Yes,
Of
please.
course. So now we will come to the major part of our discussion today, which is really about the prevention of lung cancer. So, as you already said, smoking is one of the major risk factors for lung cancer. So, how does smoke really affect? How do cigarettes or tobacco affect the lungs?
Right. Smoking, which is the commonest form of tobacco ingestion, I would say, is through harmful substances. There are about 7,000 chemicals in the cigarettes or smoke, various forms of smoking. And in them, about 250 chemicals are supposed to be harmful. And as you were telling a little while earlier, 70 of them are really supposed to be uh, allowing them to become cancerous. So 70 harmful substances in the smoke. And then nitrosamines are one of the important substances. In fact, people say that it is directly related to the amount of nitrosamines. More nitrosamines, more the possibility of cancer. And then there are lots of other substances like benzene, formaldehyde, various other chemicals, carbon monoxide, and so on. And those are all the substances which can constantly irritate the airways and over a period of time make a cell cancerous. And once the cell becomes cancerous, there is no looking back. It only keeps multiplying, and then patient is coming to the doctor.
There is often this view that other types of tobacco consumption, like vaping or e-cigarettes or hookahs and or other types, or there are ways of consuming tobacco in a non-harmful way, which is a myth which is prevalent even among the youngsters today. So, could you give us a little advice on that?
Yeah, yeah. I'm glad you asked that question. Not just smoking, there is something called smokeless tobacco, which is what snuff, which we in India, especially in the mopsil areas, in the villages,
Yeah.
the people do snuff, and which goes into the nasal airways, and it causes cancer. It is chewing tobacco. The people keep the commonly used word is zarda, pan, and all, and they keep it in the mouth throughout the day, and constantly it irritates the oral cavity pathways, and that can cause cancer. In fact, the tobacco can cause cancers in so many organs in the body. If you start from the nose, the nasal airway, the oral cavity, the tongue, and then the larynx, then you go down to the esophagus, stomach, pancreas, every area, bladder, urinary bladder, and so on. And in women who smoke, in fact, the number of women who are smoking is supposed to be increasing day by day because female liberation, so to say, is also connected to the freedom to smoke, and it's causing more harm to them, especially if a woman is pregnant and smoking. It can cause even acute myeloid leukemia in the child. 36% of these women develop cancer themselves or in the child who is going to be born. So it's so dangerous. One of the worst kind of addictions is smoking, I should say.
Not to mention the other non-cancer risks also that smoking causes in terms of heart disease, stroke, all other things.
Diabetes, yeah, you're right.
But
Lots of
all types of products, even the so-called, because there is a marketing ploy that, e-cigarettes are not harmful, and you find these people having other types, the hookah bars and things like that. But I think they are
right.
equally harmful and should be avoided.
It could be dangerous, and e-cigarettes are not to be advised. Only the content of the harmful substances may be little less, but it's all the
Yes.
same.
So that brings us to the question of, like if you have gotten into the smoking habit, how do you quit? Because it's always a challenge to quit these addictions and dependencies. So what would your advice be if, like somebody has been smoking, they want to quit, but they don't know how to?
Right. Quitting smoking comes from the knowledge that the danger that it can cause. Maybe hearing things like this or reading or whatever method. And it's, in fact, most smokers also know that they are dangling with danger. But then it's the question comes how to stop. The first thing somebody wants to quit smoking is to have the determination. They should say, I want to quit for the sake of my life. If they understand that, and once the determination is done, then only other things will follow, of course. And smoking has to be done in a flash. They should not think that, okay, today I'm taking 10 cigarettes, I'll do 5 tomorrow. No, you have to stop all of a sudden. Now, when we stop suddenly, the nicotine in the cigarettes causes problems. That's the one which is actually addictive, not all the harmful substances that we have spoken about. And so you can take the help of professionals like us or the chest physicians to have advice on the nicotine in a manner not from the tobacco but from other sources.
There's just one more question that I have regarding lung cancer itself. I mean, there are people who never smoke who also get cancer. So, is that a large percentage, or in your experience, you think that the majority of the lung cancers are due to smoking?
It's about 20 to 30% of the lung cancers occur in non-smokers too. In fact, the first question a non-smoker with lung cancer comes and asks me is, why did I get this? I've never smoked in my life. Well, now there are a lot of reasons. As I said, pollution, one of the causes. Second, the radon gas, asbestos. These are all things which are already known. And then passive smoking. Even if you have a family member who is smoking, that is enough. Then in the passive smoking, when the individual smokes, there is a side stream smoke, which we say, which comes from the sides of his mouth. And then there is a mainstream smoke, which is also causes this passive smoking. The individual just releases, he inhales and then he exhales. Whatever he exhales, the other people are exposed to. And so these are some of the things which can explain the incidence of cancer in non-smokers. And of course, there is this little bit of genetic instability in some people's genes. And in those cases, in fact, more than one member of a family may be affected, even without smoking, for lung cancer because of the genetic instability which triggers a cell to become cancerous. So there are all the explanations for non-smokers getting it, but it doesn't deter us from today's message of telling them that smoking is dangerous and it causes 80% of lung cancers.
So thank you so much, Dr. Prasad, for this very, very informative discussion where I think we have covered all aspects of lung cancer and also this very, very valuable message that You got to quit smoking now, because there is innumerable health problems that can be caused by cigarette smoking and tobacco.
Regarding the quitting aspect, some of them may be interested about this nicotine thing. They are available in patches, in tablets, which has that chemical which neutralizes or prevents the receptors of the nicotine inside the body. They should just get to a chest physician and with a determination to stop smoking. And then these nicotine patches, day by day, the amount of nicotine is reduced in the patches. Each 24 hours there is a reduction, and in 4 weeks' time, they should be easily be able to stop their smoking habit. It's not difficult, it's very easy. And each year they stop smoking, they are benefited more and more, and they are away from the lung cancer danger again. That's the most important part. Stopping smoking. And in fact, one more point which I have to tell is, if the individuals have cancer and still are smoking, even if they stop also, their recovery rates are good. So stopping smoking at any time in life is always good.
So another key message there from doctor is also that you're not alone in this. So if you don't have to do this alone, you need the willpower, you need the determination, but there are ways to actually quit tobacco with minimal discomfort, and we are always there. So seek help from a chest physician or your general physician, and now there are many ways where we can help ourselves to quit smoking without all those discomfort of withdrawal. So do seek medical help if you want to quit smoking. With all your willpower and determination, you can do it. So this has been a wonderful discussion, Dr. Prasad. Thank you so much. Viewers, I hope you enjoyed this session, found it informative. Do continue to follow us on our social media channels, where we have many such interesting and informative discussions. And of course, do interact with us, post your questions, post your comments, and we'll get back to you. And you know that we're always available in our many hospitals and clinics throughout the country to provide service for you, provide advice and assistance whenever you need. Thank you so much, and namaste.
Thank you all. Thank you.